In today's Eye on Health, we have a very important topic to talk about. Pregnancy is an exciting and an anxious time sometimes. Now, COVID-19 is in the picture. So what do expecting couples need to know as their due dates near?
Yeah, we are calling in Allegheny Health Network maternal-fetal medicine specialist, Dr. Jordan Knight, to get some answers to questions moms and dads-to-be may have. Thank you so much for joining us, doctor. We really appreciate it.
Absolutely, my pleasure.
And, you know, pregnancy, of course, can be an anxiety-filled time for some people. Now with COVID-19, what are you hearing from these moms and dads-to-be? I mean, what are their concerns right now?
Absolutely. This is very unprecedented. Anxiety is very high, and for good reason. This is new. I mean, the most concerning thing we hear from patients is mostly, am I going to be able to deliver safely in the hospital? And that's our number one priority is being safe for both providers and patients, and having the experience be as normal as possible. We've been implementing the guidelines that everybody has been using nationally through our College of Obstetrics and Gynecology, Maternal-Fetal Medicine, the WHO, the CDC, to implement the practices that everybody's doing, social distancing, and if you're sick, not coming in, and to reach out to your doctor, especially if you're having any of the symptoms that would be concerning for COVID-19.
Well, I know getting sick during pregnancy is especially hard because there are very few medications that you can actually take. Are pregnant women at greater risk of contracting COVID-19, and could that cause problems with their pregnancies?
That's a great question that we often hear, and unfortunately we don't have a ton of data as this is a novel virus, but as far as we know, patients aren't at a higher risk of contracting the disease, nor having a more severe disease. But with that being said, pregnancy does suppress the immune system, and it's important to pay attention to those symptoms and reach out to your doctor to get some advice on what to do. As far as pregnancy complications, again, there's not a ton of data out there to rely upon as far as miscarriage rates or preterm labor or other complications that we would counsel other patients that have known viruses that could affect pregnancy.
Doctor, if a woman does have COVID-19, can she pass it to her newborn? Is that necessarily something that would happen? Or is that something we're not sure of right now? Because as you say, this is so new, we're getting new information all the time.
Yeah, that's a great question, David. There isn't as much information, and the current answer is we don't think so. I mean, there's certainly been a small case series out there that have looked at some cases in China that fortunately, what's called vertical transmission not been seen, and that's an important point. So it's been tested in the amniotic fluid and placenta, and the virus has not been positive in those cases. There have been cases of neonates 1 or 2 days old that have contracted it, and we can't specifically answer that question from an exposure standpoint of whether that was contracted after delivery, but where we stand now, vertical transmission has not yet been seen.
So I know there were some reports early on about whether or not to separate mom and baby after the birth because of fears of coronavirus. How does that play a role in all of this? I know that has to be a very anxious feeling for expecting moms. And also, how does breastfeeding play a role in all of that?
Absolutely, Heather. I'll start with the first question. As far as implementing safe practice, it applies to pregnant women just like others. And we have special protocols in place here at Allegheny Health Network at West Penn specifically, and the outlying hospitals to essentially treat people that are either under investigation or with COVID to remain safe, essentially. And separation is going to happen, unfortunately, to keep both baby and mom safe. In terms of breastfeeding, we still recommend it. It's something that's very important. Passive immunity is a huge deal, and it's something that we will take every standard precaution to try to eliminate that risk of passing it from mom to baby in that setting.
Mm-hmm. Okay.
Thank you so much, doctor. Thank you, Dr. Knight, for joining us, because we really appreciate your time, and hopefully people hearing the answers to some of these questions can make people calm down a little bit. It's important just to have the information.
Feel a bit of relief from that.
Yeah. Well, remember to keep watching our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.